On the second day of reading the prescriber, third edition of JH Clarke, we studied the first para of the first part, how to practice homeopathy. Number one, the necessary implements. Today we are going to discuss about the second chapter, the comparative value of symptoms, the prescriber and the clinical repertory. Cases in point. Before proceeding further, it will be well made to clear some symptoms or diseases manifestation are of some more value than others from the point of view of selection in remedy. And it often happens that some symptoms which are of the smallest value in diagnosing the remedy, it will be noted throughout. The prescriber that it distinguishes one remedy from another, great attention is paid to the time and condition under which the various symptoms are better or worse, ameliorated or aggravated. The greater than sign and less than sign are used. Greater than sign is for aggravation and less than sign is for amelioration. The greater than sign is used to indicate amelioration and the sign less than is used for aggravation. This point is often of more consequence than the actual symptom itself, and yet these characteristics would give little or no help in the diagnosing of the disease. Perhaps it may help in understanding the differential value of symptoms and their conditions or modalities. If I instance a case, Miss T, aged about 60, consulted me on October 7, 1908, about a pain which had troubled her more or less for 25 years. It affects the right side of the head and right cheek. In the temple are violent sharp shoots of the pain. In the cheek it is sudden pain, burning as if on fire. It is worse while eating, worse by touching, better after eating. It is worse if the patient is chilled and is sometimes worse at night. In dealing with case like this does not assist us much whether we name the affections neuralgia, neuritis or tictodoloriacs. We must deal with it on the strength of the characteristic symptoms. The first point of the importance to note is the locality of the pain. It is one-sided, the sided affected being the right. The next point is it is sudden pain, violent, sharp, shooting and burning. In this instance, the nature of the pain is important, one account of the peculiarity of suddenness. The next point is the condition, aggravated by chewing, by the least movement or touch, and the last point aggravated at night. If this patient had applied to an old school practitioner, all these details would have been useless to him. All he would have needed to base his prescription on would have been the word neuralgia. It would have been signified nothing so far as his prescription went mattered. What made it better or what made it worse, or at what time of day it came on. The homeopath, these are everything. to the homeopathy. Turning to the prescriber, under the heading of neuralgia, will be found a number of remedies affecting the right side of the head and face. And among these, sudden pains, especially of right side of the head and face, greater than by the least movement or touch, eating or sparking, aggravates. 4 to 8 pm, lycopodium 200 was prescribed, and 2 months later, the patient wrote to say the pain was relieved in a most wonderful way. There are other ways in which this remedy might have been found besides consulting the prescriber. It could have been found by the ordinary symptoms repertories. It could have been found by reference to the materia medica itself. The fact that the pain was on the right side of the head and face was enough to make anyone but slightly acquainted with the homeopathic materia medica. Look up lycopodium, and the reference to the heading head, face, and teeth would quickly reveal its appropriateness. It is impossible to carry all the symptoms of the materia in one set, but it is quite possible to remember a large number of characteristic symptoms and modalities of the cheap remedies. And after all, the best repertory anyone can have it in his own memory. Only it must be possible to supplement it whenever required. Every remedy has a number of symptoms and modalities which are generally in respect to it, that it is to say they qualify a very large proportion of the manifestation, so that when the practitioner meets with them in a patient, he will be able to select the remedy even if the particular symptoms are not in precise correspondence. And it is the same with the patients. Many patients have general conditions which belonging rather to themselves than to the particular complaint they may be suffering from, and when these are present, they are often of greater importance from the prescribing standpoint than the actual symptoms of the disease. For instance, if the cardinal symptoms of sulfur crop up in a patient, sinking at the feet of the stomach at 11 am, aggravation of the symptoms at night in bed, hot hands and feet, burning on the sores, must put them on the bed confined to a cool place. Sulfur will be the remedy for the patient, no matter what the nature of the disease may be. Under this heading, chronic disease in the prescriber, I have indicated how this knowledge may be made use of in selecting remedies. In this way, the prescriber is sometimes more than a mere clinical repertory. It is a repertory of localities. Under the difficult organs and parents and parts of the body named will be found in the remedies which have been specified relationship to them. Further, under the heading mind will be found some leading mental symptoms and states, the presence of which complicating bodily diseases or concomitant with them, as it is technically called in homeopathy, will point to the remedy to be selected. I will now relate another case in illustration. JP 58, a coachman, was sent to me by his master on May 10, 1910. He had severe domestic trouble and was suffering from great mental depression, and in addition there was a pain in the head. The pain was situated in the vertex and was greatly aggravated if he was in the last and in the least orit. The second of the 5 sections into which the clinical repertory to the dictionary of materia medica is divided. Repertory causation. It is often great importance to know the cause in which every state has originated. The effects of the chill, physical injury or mental shock correspond to the different remedies, and the knowledge of the cause is often important guide in finding the remedy. On turning to this part of the clinical repertory, under the heading ORI, will be found among the remedies. Ignatia will be the leading. As this patient had much worry about his complaint was aggravated by ORI, Ignatia 30 was given, but it did no good. The reason of this failure was this: although ORI was an exciting factor in the cause, it was not the fundamental cause. The complaint belonging to the patient himself. The condition now was head bad. Pain in vertex comes anytime, feels it for a time after getting into the bed, very low spirited. Hands and feet was warm and moist. So, on referring to this description of different constitutions under chronic disease, the prescriber, it will be found that this patient corresponds to sulfur in some of these characteristics, but perspiring hands and feet, low spirits, night aggravation. On referring to sulfur is in the materia medica under section head, it will be found that sulfur has numerous pains referred to the vertex. On these indications, sulfur 30 was prescribed with very speedy relief to all the symptoms. But the improvement only were certain way and then ceased. What next? There is a section of the clinical repertory which I think I use more than any other, and which I fear most of my readers had no learned to use or feel the want of. It is section of clinical relationships. So today it is up to these lines. Tomorrow I shall read the next remaining part of the second part. Okay.